Hello, I'm Chris Kristen from the Omaha World-Herald. It's my distinct honor to introduce to you 10 special people who represent the heart of healthcare in Omaha. These extraordinary individuals were nominated by World-Herald readers for the impact that they've made in a year consumed by COVID-19. I'd like to thank our sponsors, AARP Nebraska, Hillcrest Health Services, Medical Solutions, and Nebraska Medicine for their support of this important initiative during National Nurses Week. And now, without further ado, meet our 10 honorees.
I think nurses have a very special role.
The role of the nurse is really to take care of the whole patient, and that can include their family and everyone else that's involved in their care.
We are there to assess patients, intervene when necessary.
To be their confidant, to be their advocate, to be their caregiver.
That way I can be the best advocate possible for that patient.
Hospice is a completely different experience. You know, it's you're walking somebody through the final stages of their life, and it's a once-in-a-lifetime thing.
This year has been a difficult year.
This last year as a nurse has been a total new role for everyone in healthcare.
COVID has been a beast, that's for sure.
Help was needed virtually everywhere, all the time over this past year.
It forced us to adapt, it forced us to adjust.
Everything is unknown. The information changes daily.
A lot of new challenges.
Learning and sacrifice for everyone.
The different kinds of treatments that we would use were constantly being updated.
COVID has affected everyone so differently.
It's made it a lot more difficult during COVID.
It's been hard.
Families rely on the bedside nurse almost entirely to hear status updates on their loved ones, to hear about their loved ones at all. Frequently their loved ones can't communicate with them if they're too acutely ill to do so.
Lots of family reached out to us as nurses, and we had to be the communicator to the family members to let them know what was going on with their loved one.
Our first job is to calm that fear and just try and give them some information and give them some reassurance.
We were the person that stayed with the patient and helped their families.
Be there for the patient and stand in for that family the best that I can.
The nurse really became everything to that patient when we weren't able to have patients and families.
A hand to hold or a little extra smile or support, and know that they had someone there who was helping them.
Being able to make treatment decisions and end-of-life care sometimes in the ICU.
A lot of times our families may not have any medical background and they may not understand the information that they're hearing.
Being a nurse to me is doing my all for every person that I come in contact with, and making sure that I'm giving them the best care I possibly could.
I either wanted to be a nurse or a veterinarian.
I've always really loved caring for others, and so this field has really just spoke to my personality and how I really wanted to help the world.
It's very rewarding to be in that position. It's difficult when you're in it, but it's very rewarding to reflect on what you've been able to do to help that family or help that patient to get through such a difficult time.
I just decided that was my calling, to be a nurse. And I love to be with people and have conversation with them, give them support when they need it, families or the patient.
But also I wanted to have a career where I could look back and feel like it was meaningful in some way.
The fact that I'm able to walk that journey with the patient and the family, it's just an incredible experience. It's very, very rewarding.
Healthcare becomes an increasingly important part of our lives as we get older. And we know that nurses play a critical role in the healthcare of our members. And so taking this opportunity to be the title sponsor of this recognition effort was really important to AARP Nebraska.
Nebraska Medicine is well known in the community for the specialized care that we give. We often hear our patients say, when you're really sick, it's when you go to Nebraska Medicine.
Medical Solutions is one of the largest healthcare staffing companies in the United States, and what we do is we're fortunate to work with nurses that want to go work in different communities where they can make a difference and provide patient care.
We employ over 200 nurses in all of our facilities, and they are a tremendous support to the residents as well as our patients as well as the family members.
We know how to care for patients who are very, very sick, whether it's from an infection or any other kind of disease.
The past 14 months with COVID have been unprecedented, and our nurses have had to pick up those additional responsibilities relating to COVID.
Incredible to watch what nurses have done. And in time when we're at home quarantining, they're going into the storm of the pandemic and these really stressful and high anxiety situations and putting themselves at risk just to care for others, to make a difference in the lives of so many people, especially when their families can't be there next to them. It's the nurses that are serving in this capacity to show them love and to show them compassion and try to get them through this really tough time that they're going through.
We also want to take this opportunity from Hillcrest to thank all of our nurses that work in our facilities for their hard work and their continued dedication to the profession. They have such a tremendous impact.
This program is just such an honor to be able to recognize our nurses. And I wish that I could give an award to every nurse. The hard work that everybody did this year is unprecedented, just as the pandemic is.
Well, I think this is actually the perfect opportunity to stop and recognize the nurses for the role they've had in helping fight this pandemic. I think we've all been moved by the stories of bravery and dedication from nurses. That they've played that critical link between families and patients of COVID-19 who are sick or dying has been sort of heart-wrenching for all of us to see those stories. So I think it's actually the perfect time to pause and to say thank you and to recognize the dedicated service of all of our nurses across our state.
And I'll say honestly, there's never been another thought in my mind of doing anything else other than nursing.
It's just what I do. It's what I want to continue doing. It's
caring for people, that is what I do.
I don't question it. I just keep coming back.